Nurses across the country have raised concerns about lacking the proper training to treat a patient with Ebola.
In East Texas, hospitals tell us they are in the process of training their staff. Tonight, our Summer Dash explains exactly what that training means and how nurses and doctors are being prepared for any possible cases.
Emergency dispatchers are now asking the question, have you been to West Africa in the last 21 days or had contact with someone who has? If the answer is yes, the protocol handed down by the CDC is put in place.
All of EMS will respond. We do not have a specific truck and a specific crew, and that's mainly because we cover nearly 17,000 square miles.
ETMC EMS employees are all in the process of being trained on how to properly put on and take off gowns and gloves. 4 sets have been placed in all of their ambulances, Tyvek suits on back order, so until then they'll use this.
I'm not going to tell you that I wouldn't be nervous about it. I think anybody would be nervous responding to that type of a call.
Greg LeMay is helping to train others and is filming a training video focusing on using a partner to help dress and undress to avoid mistakes.
Sometimes, unfortunately, and this is going to come off kind of harsh, is that we get kind of complacent. We think that, oh, it's not going to happen to me. And that's probably the worst thing that you can think.
The CDC encouraging the mindset, think Ebola. At ETMC, volunteers have been asked to take part in extra training classes.
We're not forcing any employee to do it. It's just those employees that want the additional training, want to work with these types of patients that will receive the training and be on these response teams.
Not every staff member needs to be trained, Kenneth Webb says. He tells me more than 40 ER staff members have volunteered and been trained.
We're limiting the amount of people that has the one-on-one patient contact.
UT Health gave every department this book, a video, and all staff will be trained at this hospital.
We're trying to make sure that every one of our staff that are going to be exposed to that have the understandings of how to put on the equipment appropriately, take it off appropriately, and manage it safely.
Northeast Texas Public Health District officials say they are participating in conference calls with the state and CDC almost daily for an update.
With how to look after the patients, what has occurred, what you should do, how you would manage doing things like lab tests, how you would transport specimens.
They all say their staff is trained for any infectious disease, but they are always working to become more prepared. Summer Dash, KLTV 7 News.
ETMC EMS also tells us fire departments have been told to not respond to a possible Ebola patient. Those calls will be left to EMS to limit how many people come into direct contact with a possible patient.